Hi friends, I am Dr. Pratap Rathod. I have done the MD in Forensic Medicine. In today's video, we will start with sedative and hypnotic group of poisons. In that, we will discuss mainly about poisoning from opium. Opium or opium is a dried juice obtained from the poppy plant, also known as Papaver somniferum plant, which is cultivated in India and other eastern countries only under the license. Opium occurs as rounded, irregular formed flattened masses which has a strong characteristic odor and bitter taste. The plant, that is Papaver somniferum, grows up to 1 meters in height, bears up to 5 to 8 capsules, and usually flowers are white in color, which turns into capsules. Coming to capsules, the unripe capsules are incised and white juice which exudates is collected and allowed to evaporate to obtain opium. So, whenever the unripe capsules are present, the incisions are made. From the incisions, white fluid exudate is obtained, juice is exudated, which is allowed to evaporate to obtain opium. Ripe and dry poppy capsules contain a trace amount of opium and also used for sedative and narcotic actions. So, even the dried capsules are also used. Coming to seeds, the poppy seeds, also known as cuscus, are white, harmless, demescent, and nutritive value only has nutritive value used as food. So, mainly in case of as for sweet purposes. The oil from seeds is used for cooking purposes. They are also commercially available, sold, mainly used to prepare sweets. Coming to active principles, crude opium contains about more than 25 alkaloids which form into two chemically different groups. One is phenanthrines and one is isoquinoline groups. Phenanthrines includes morphine, which is about 10%, codeine about 5.5%, and thebaine about 0.3%, which are narcotic in action. Isoquinoline groups includes papaverine about 1%, narcotine 6%, which have mild analgesic but not narcotic properties. So, phenanthrines are narcotic and dependency, they cause dependency and addictive formation. Isoquinones are mainly used as an analgesic, but they have no narcotic properties. The thebaine acts as a convulsant. Morphine occurs as white powder or as white shining crystals and has bitter taste and alkaline reaction. The morphine has narcotic symptoms of opium poisoning, are practically those caused by the morphine only. Classification of opium, naturally it is classified into morphine and codeine, which are used. Semisynthetic compounds are there which are derived from the natural substitute. They are chemically related to opium alkaloids and are called opioid analogues, which includes heroin, hydromorphone, oxymorphone, and oxycodone. Synthetic are chemically prepared synthetic analogues of opiate, which are also called as designer drugs. These are manufactured illicitly in clandestine laboratories for recreational use, which are highly potent and addictive. Examples include mephedrine, methadone, leofranol, tartrate, paragonoric, and diphenoxylate, fentanyl, and propoxyphens. Coming to actions, opiate excites the effects because of their chemically similarity to the natural substance called endorphins and activate their receptors. So, usually human body produces endorphins which have specific receptors in the body, and opium acts on those receptors leading to similar effect as those of endorphins. Opium depresses all centers except of oculomotor, vomiting, and sweating. So, endorphins has receptors all over the body, and only centers like oculomotor, vomiting, and sweating are not affected by opium. It is peripherally active as an analgesic. It stimulates non-propulsive rhythmic contraction of small intestines, and opium derivatives act synergistically with alcohol and barbiturates. So, if opium is consumed with alcohol and barbiturates, their action is increased. So, they synergistically increase each other action. So, if alcohol is taken with barbiturates, alcohol is taken with opium, their actions increases as whatever the combination they are consumed. It is absorbed from mucous membrane, raw surfaces or wounds, or hypodermic injection when smoked in cigarettes. So, these different modes opium are usually used. They can be used from mucous membrane, like they are inhaled from the nose, raw surfaces of the wounds, or given by injection also, smoked in cigarette also it is absorbed. It is metabolized by the liver. It is emitted mainly as morphine in urine and feces, and also by stomach, intestine, saliva, bile, and milk. So, they are secreted in body fluids like in saliva, bile, and milk. They can be secreted, metabolized into morphine, and secreted in urine and feces. Coming to signs and symptoms, The contact of morphine with skin sensitive persons may cause erythema, urticaria and itching, dermatitis. So, in some sensitive individuals only, if the opium is applied and if comes in contact with the skin, they can cause erythema, itching, dermatitis and urticaria. When opium is taken by mouth, symptoms begins within half hour. If the drug is injected, its action starts within 3 to 4 minutes. If it first stimulates, then depresses and finally passes nerve centers. So, similar to alcohol also, it causes alcohol causes depression, then afterwards it stimulates, but in opium it first stimulates, then depresses and finally passes the nerve endings. The signs symptoms goes into 3 stages: excitement, stupor and coma. Coming to stage of excitement, in stage of excitement it is a state of short duration and may absent if large dose is taken. There is an increased sense of well-being, increased mental activity, freedom from anxiety, talkativeness, restlessness or in hallucinations, flushing of face and greatly excited or manic condition may be seen. So, similar to that of alcohol, in first stage of excitement, the person feels increased well-being, anxiety, talkative and restless will be present. In stage of stupor, the symptoms are headache, nausea, vomiting, incapacity for exertion, a sense of weight in the limbs, giddiness and drowsiness. The subject lies motionless with eyes closed as if it in the sound sleep, from which he may be aroused at first but soon pass into stupor and coma. So, if the person consumes and if he may pass into coma, but in the stupor stage the person restless, he may just lie down, he may be giddiness be present, drowsiness be present, he may be aroused initially but later on he goes into coma. The pupils are contracted, face and lips are cyanosed and an itching sensation is felt all over the skin. The pulse and respirations are normal, only pupils are contracted. In stage of coma, the patient passes into deep coma from which he cannot be aroused. The muscles become flaccid and relaxed and all reflexes are abolished. The face is pale and conjunctiva is congested. The pupils are contracted to pinpoint size and do not react to light but dilate during the agonal asphyxial phase caused by respiratory depression, ultimately paralysis. So, usually if the person continuously consumes the opium and he may go into stage of coma where he may not be able to arouse, all the muscles become flaccid, face is pale, the pupils are contracted but later on became dilated if there is a agonal asphyxial phase is caused and respiratory depression, paralysis may occur. All the secretions are suspended except sweat and increased perspiration. The skin is cold and temperature is subnormal. Blood pressure is low, pulse is slow and full, and the breathing is slow and stertorous and may be reduced to 3 to 4 per minute. Odor of opium may be present in the mouth. So, usually all the secretions will be suspended, skin's perspiration is because of increased perspiration, the skin is felt cold, temperature is little bit decreased, blood pressure is low, pulse is also slow and the respiration rate to reduce to 3 to 4 per minute. In case of fetal termination, lividity of surface increases, pulse becomes slow, irregular respiration and may become Chinese stroke of type. So, in Chinese stroke of type, there is slow increase in inhalation, later on it becomes increasing and it may pass out. So, death usually occurs in deep coma from asphyxia. The skin blistering sometimes is seen in the body, which is because seen in dependent parts of the victim of deep coma is due to cutaneous edema. So, because of dilatation of blood vessels, the blood starts accumulating in independent parts and there is edema formation leading to blister formation. Fetal dose: opium is 2 grams, morphine is 0.2 grams, codeine is 80 milligrams, methadone is 100 milligram, papaxifene is 1 grams, pentazocine is 300 milligrams, fentanyl is about 50 to 100 times more potent than morphine and it is also fatal. Fatal period is 6 to 12 hours. So, opium poisoning has to be differentiated diagnosed with the other conditions. In opium poisoning, typically there is odor of breath of opium is present, slow pulse and moist perspiration skin are prominent. The triad of coma, pinpoint pupil and immobile pupils are respiratory depression are diagnostic. So, coma, pupils and respiratory depression are the diagnostic of opium poisoning. In acute alcohol poisoning, odor of alcohol is present in the mouth, congested eyes and hyperemia of face and neck, pupils are dilated. Here pupils are pinpoint, it is dilated and reacting. Subnormal temperature, slow and suchness breathing is present in alcohol poisoning. In barbiturate poisoning, there is respiration is shallow, deep coma, no response to painful stimuli, deep reflexes are depressed, subnormal temperature, low blood pressure, steady pulse and dilated pupils. Again the pupils are dilated here. Respiration is shallow. Person usually in the deep coma will not be arousable from stimuli. Even in the stimuli is given, it is not arousable, but in opium poisoning he may be arousable. Carbolic acid poisoning, here odor of breath of carbolic acid is present, white patches on lips and mouth are present, and carbuliria is present. In carbon monoxide poisoning, which is asphyxiant, there is history of exposure to the poisoning. There is intermittent convergence, cherry red color of the skin is present because of carboxyhemoglobin in blood. Epileptic, history of epilepsy is present, pupils is fixed and dilated, skin is flushed, face and lips are cyanosed, froth may be seen in the mouth and nostrils, tongue may be bitten, slow respiration and rapid recovery is seen in epileptic coma. Uremic coma, because of increased uremia and urea in the blood, gradual onset, pallor of the face, Chinese stroke breathing, ammoniacal odor is present in the mouth, general anasarca, epileptic form convergence is present, albumin blood and castor seen in urine. In diabetic coma, gradual onset, flushed face, so slow and deep respirations, low intraocular tension, subnormal temperature, sweet odor of acetone is present in the breath, sugar and acetone is seen in the urine. Next is hysterical coma, usually seen in females, where the previous history with convulsive movements usually occurs in presence of audience, where the woman starts acting up and have coma. There is unusual attitude is present, reflexes are not altered. Cerebral hemorrhage, usually seen in old age, sudden onset, history of hypertension, slow full pulse, Chinese stroke respiration, respiratory paralysis, usually hemiplegic, dilated pupils, raised temperature and bilateral extensor plantar reflexes will be seen. In brain trauma, history of trauma, head injury is present, bleeding from the bleeding, mouth and ears respiration is rapid, irregular or Chinese strokes respiration, pulse is rapid, later it becomes slow, pupils is inactive, often unequal paralysis of cranial nerves and subconjunctival hemorrhage is present. In cerebral malaria, history of fever with rigors, enlarged spleen and maybe hyperpyrexia is seen. In encephalitis, again fever is present, acute onset, involuntary movements, ocular paralysis, changes in the cerebrospinal fluid is present. In meningitis, there is gradual onset, signs of meningeal irritation and fever of CSF is present. So in all changes, opium as pupils will be contracted and respiratory pressure is present. Then heat hypoxia, prolonged exposure to high temperature, congested conjunctiva with contracted pupils, hyperpyrexia, increase in body temperature is present, absence of sweating are seen, which is an indication of hyperpyrexia. Coming to treatment, gastric lavage is done and it is done frequently with solution of 1:5,000 potassium permanganate. It is also useful even in case of injected drug, because once the opium may re-enter the circulation, re-enter the stomach after even after some times. So because of gradient, the opium may enter the stomach, and if it is gastric lavage continued, opium may be removed from the stomach. A tablespoon suspension of charcoal may be introduced in the stomach to remove in upcoming opium. The intestine should be cleared out by enema twice daily for 2 days to prevent reabsorption. Adequate respiration should be maintained, airway should be maintained, even endotracheal intubation if necessary. If oxygen is decreased, then intubation should be done. Atropine is not recommended, and if it is even given, it can increase the respiratory depression. Naloxone is the treatment of choice. Naloxone hydrochloride is a specific opioid antagonist. It competes with opiates at receptor sites. So opium and naloxone, they both compete for the same receptors, and naloxone will activate and remove the opium from the receptors. It can reverse not only the respiratory depressions, analgesic and euphoric effects of opiates, but also the dysphoric, delusional, hallucinatory properties of synthetic opiates. So it acts on all the effects of opium. It is usually given in 2 mg IV repeated, and total dose of about 20 mg IV can be given. Nalpaphine is another drug which also has longer duration effect than naloxone. Coma cocktail is usually not given nowadays. It is usually practiced where the drug which the person has consumed is not known. is usually given in comatose patient where the identity of the poison is not known. Then this includes 100 ml of 50% glucose, 100 milligram of thiamine, and 2 milligram naloxone, which is given IV. So, if the comatose patient comes with no response to stimuli or anything, if no poison is known, then this is usually given. Now it's not given. Norphine and levonorphin are not recommended for treatment. Dextrose 50 ml of 50% solution IV and thiamine 100 milligram is given. Physostigmine 0.004 milligram per kg IV may be given to reverse the suspected depression if naloxone is not available. Amphoxolone 20 to 40 milligram IV can be given if necessary. If coma is deep, artificial respiration is started. Analeptics, that is stimulants like amphetamine, caffeine or amphetamine may be given. Buprenorphine and LAM are considered effective in long-term management. Symptomatic treatment is given as generalized management. So, you should remember naloxone is the treatment of choice and is a specific antidote for opium poisoning. Coming to postmortem appearance, they are not characteristic but signs of asphyxia are prominent. The face and nails are cyanosed, froth is seen in the mouth and nostrils. Postmortem staining is well marked and cyanotic, that is deep blue is present. The smell of opium is present in the opening of the stomach, chest, but it may disappear if putrefaction has set in. Stomach may contain small lump of opium. Trachea and bronchi are congested and covered with froth. Lungs are edematous and congested, again the signs of asphyxia. Brain, meninges and abdominal organs are also congested. Blood is usually dark and fluid. Opium disappears rapidly from cadaver, so it is very difficult to identify, but morphine can sometimes be detected in liver or bile. Opioid drugs can also be identified in hairs. Marquez test, this is test has a bedside or some immediate test can be done to detect the opium. A drop of mixture consisting of 3 ml of concentrated sulfuric acid and 3 drops of formalin added to a fragment of suspected residue produces purple red color, which gradually changes to violet and finally to blue, which indicates that is a opium. So, here the mixture of concentrated sulfuric acid and 3 drops of formalin is added to the fragment of suspected solution, which leads to purple red color formation. It is also known as Marquez test. Come to circumstances of poisoning. Opium is selected by suicide because death is painless. It is rarely used for homicide because of its bitter taste, characteristic smell and odor. Poisoning may occur in addicts because of overdosage. Drugging of children by opium to keep them quiet and overdosage of medications containing opium may result in accidental poisoning. It is rarely used as a cattle poison. It is sometimes used as a doping race horses. Sometimes opium is used to steady the nerves for doing some bold act requiring sufficient courage, which may lead to accidental overdosage and accidental death. Chronic poisoning of opium is also known as morphism or morphinomania. It is development of tolerance is high with opium, so smaller doses if the person starts consuming, it is addictive formation leading to morphinism. The habit is acquired by young people as it is believed to be aphrodisiac and it produces a sense of euphoria. Opium addicts can tolerate up to 3 to 6 grams per day and they usually develop tolerance and get addicted. The morphine addict has a dry skin and chow scars of healed abscess themselves are sometimes tattooing because of from needles. The habitual use first causes a pleasurable feeling of life and well-being, but larger doses are taken, there is a disinterest, recurring periods of depression will follow. First they feel euphoric, then later on they start depressive. The patient becomes restless and irritable and sleep is disturbed by dreams or there is insomnia. Loss of memory, mental fatigue and gradual intellectual and moral deterioration occurs. Sometimes hallucination may also occur. Constipation, contracted pupils, anorexia, emaciation, weakness and impotence are frequently seen. Sudden cessation of opioid use in dependent or pregnant women may lead to life-threatening changes in fetus also. Treatment of chronic poisoning, gradual withdrawal of drug is given. Methadone 30 to 40 mg daily to be tapered off gradually is provided. Naltrexone combined with chloride is also treatment available. Propoxyphene, difenoxylate, buprenorphine, iofexidine are alternative to methadone for treatment purposes. Dihydrocodone or codeine may be suitable for less severely opiate dependent. So, other opiates are provided and gradually the dosage is reduced to recover from the addiction. Propranolol 80 mg relieves anxiety and craving. Tranquilizers or sedationists at bedtime is required, and psychiatric counseling is also required. Come to next opium opioid is the heroin or brown sugar, which is street level it is available. There are three types of heroin: white, brown or black tar. Street heroin is known as smack, junk or dope. Different names are available. It is a diluted and quinine, lactose, mannitol, etc. It is mainly mixed with quinine, lactose and mannitol. It is not taken orally because it is rapidly hydrolyzed in the stomach. It is most dangerous among all drugs of addiction. Solid heroin, that is as morphine, can be dissolved in liquid and injected. It can be heated, and the smoke or vapor inhaled or used as a snuff. So, this mode of administration may be as solidly it is mixed in liquid, which gets easily dissolved and injected, or smoked or vapor can be also inhaled. A combination of heroin and cocaine is known as speedballs. It is 4 times more powerful in action than morphine. Metabolism, it is metabolized to monoacetylmorphine and acetylmorphine. Monoacetylmorphine is then hydrolyzed to morphine in 30 to 60 minutes. After injection, morphine and monoacetylmorphine are found in urine and is found in chemical analysis and not heroin as such. So, whenever a person's urinary test is done, only they can find the morphine as a byproduct, not the heroin. Tolerance occurs very rapidly within days and can be increased to more than 100 times the initial dose, and which leads to addiction. The treatment signs and symptoms are similar to that of opium, but due to IV administration, all stages are merged into one. So, they do not go into different stage of excitement, stage of stupor and coma, but all the stages occur simultaneously. There is intense euphoria which lasts for several minutes, followed by sedation for about 1 hour, and the effects are completely lost in 3 to 6 hours. Heroin and some opiates can cause mast cells to release histamines, can result in intense pruritus. It causes excitation by lifting cortical inhibition similar to alcohol. It can also cause sudden death even in persons who have been used it for some times with needles still in vein. So, since it is very potent, even the person, sometimes even if the one suddenly injecting, the person may even die suddenly. A few deaths may be due to some personal hypersensitivity to drugs. Overdosage can cause death from very strong synergistic depressant action. In almost all cases, the victims are under the influence of alcohol at the time of death. So, because of synergistic action, if the person has consumed alcohol with heroin, the person may even die immediately. Fetal dose is about 50 mg. Fetal period is about 12 hours. Treatment is methadone 40 mg daily will usually prevent the withdrawal symptoms. In a chronic addict of 80 mg will be useful to prevent heroin-induced euphoria. Detoxification is done slowly to remove the gradual removal from the drug. Narcotic antagonists such as naloxone, haloperidol, clonidine and cyclozine is preferred. Postmortem appearance: lungs are heavy and congested. Severe pulmonary edema is common autopsy findings due to sudden ventricular dysrhythmia. Microscopically, lungs may show foreign body granulomas. Liver shows chronic tiredness and mononuclear cellular infiltrates. Come to next opioid is mephedrine. Mephedrine hydrochloride is a colorless crystalline powder with bitter taste. It is administered by IM, IV route or for its analgesic, antispasmodic and sedative properties. So, it is mainly used as an analgesic. It is also a drug of addiction. Addiction is common among doctors and nurses because it is used as an analgesic. They sometimes try it and get addicted to the drug. It acts on cerebrum and produces analgesic and sedation. Monoaminoxidase inhibitors, phenothiazines can produce severe reactions and even death when taken together with betadine. Signs and symptoms: effects are similar to those of morphine. It can cause dizziness more than the morphine and greater elation. Tolerance to its toxic effect is not complete, and addicts may have twitchings, tremors, mental confusions, hallucinations, dilatation pupils, dry mouth and sometimes convulsions. The impairment ability to work is more than that of morphine. Abstinence syndrome resembles that of morphine withdrawal and sometimes appear in 3 to 4 hours and reach maximum intensity of 8 to 12 hours later. Then they decline rapidly and disappear in 4 to 5 days. Fetal dose is 1 to 2 grams. Fetal period is 24 hours. Treatments: stomach wash, then the naloxone may be given, then stimulants, analeptics can be given, and subsequent treatment is provided. Next is the methadone. Next opiate is methadone poison. It is a long-acting opiate with half-life about 15 hours, which has all the physiological properties of heroin. It is also used as analgesic and powerful than morphine. It can be given orally or parenterally. Next is a fentanyl. It is a 50 to 100 times more potent than morphine. It can be taken IV, orally, or smoked, snorted, or as skin patches. Some other opioid analogues which can cause addiction includes codeine, diiodocodeine, papaverine, pethidine, methadone, diphenhydramine, dextromorphan, pentazocine, cyclizine, diphenhexylate, and dextromethorphan, which are also can be used as forming addiction and tolerance and lead to poisoning similar to having similar signs and symptoms of opium, and treatment is also similar to that of opium. These are my references. Thank you.